It's been a wild few weeks so far, such as Joe Biden being elected, which is pretty wild, and a COVID vaccine shows nearly 95% protection. That is something that is off the wall impressive. Shows how humanity can come together and do something when they want to. Obviously, there are some things that we have to explain first, such as this article quite lovely portrays. How good is it? Is it actually effective? How do we know it's effective? And they shared some data with it. So again, this trial was done with 30,000 people in the USA and has shown to protect people from the virus by 94.5%. So that's pretty good, I gotta say. And then obviously some of the small information, such as how will we get it, that depends on what country you live in and whatnot. But we're going to go through that now. And then another one, which we have, is what we don't know. So simple things such as how long will the immunity last? Will it last forever? We have to take shots like every year? What is the length of this? They don't know that. They suggest that it does not appear to lose its potency with age. So again, but we have to wait for the data before we can make any guarantee estimations. Next thing is, are there any side effects? Now, again, obviously concerned about side effects, so we don't want this cure to affect us negatively in any real way. So they have said currently no significant safety concerns have been reported, but nothing including paracetamol, boy, that is bad, is 100% safe. Uh, so they say there's no side effects seen, but they're making sure that everyone knows that they don't know the full story yet. Again, they even showed some of the things over here. Short-lived fatigue, headache, and pain was reported. But again, we'll have to see full extents to it. If it's just minor things like as they state here, then probably will be worth the risk to get of coronavirus. Because as you all know, coronavirus is a thing that will affect not only your current health, but your future health as well. It will make you have a pre-existing condition. Now, there is another vaccine. There's two vaccines, the P-Visor, and they have a little nifty chart here comparing the two. So again, the doses are 2 injections to 20 days apart. That's 2 weeks. 3 weeks. And then this one is 2 injections 4 weeks apart. So this one is much more shorter. You need to get it more frequently, and this one is longer. You need to get it less frequently. Much more effective. The Moderna one, and the temperature that it has is -20 degrees Celsius, which is also really good. This one is a much more higher one. We'll also get into that Celsius one, the temperature that it needs to be stored at, because that's a very important way for poor countries not being able to get the vaccine. And then also just compare it to other similar vaccines as well. How does it work? This is mostly just going through the very specific scientific details about it, on how it attacks the coronavirus and how it is able to give them some sort of immunity. Now again, this is a pretty good article. I suggest you all read it, but we shall get into the next portion, which is, since this is a South African show, how does this affect South Africa specifically? What will this do to South Africans, everyday South Africans, right? So, thankfully, from a pretty well done article from News 24. Now, this one is just simply a bullet point list going through the very specific things, 4 specific reasons why countries will have a much more harder, poorer countries will have a much harder time to receive this vaccine. Again, there is another article, not necessarily an article, but a really lengthy explanation on the reasons why poorer countries won't really get a fare and whatnot. All the complications. This one is just very simple. This one goes into a little more detail and nuance. They do one thing I just want to point out quickly is it's over here. Yeah, right here. So as this man lovely says, not guinea pigs. Basically, poorer countries have to make sure that especially our country, has to make sure that people are able to get this virus effectively and then it won't affect them, and that they don't feel that the patients are being mistrusted. That's something that all vaccines have gone through and has a little controversies, making sure that they're not being used as, again, as this man mentions right here, guinea pigs, because it's very important to make sure that the safety of the patient is first held. But as we go through the four reasons why poorer countries won't get a fair shake, the very huge reasons. Number one, outsized demand. Now, outsized demand basically means this. So, rich countries will buy up all the vaccines. The USA, as it's pointed down here, which has 60 million doses in order, um, which will significantly restrict the ability for countries like South Africa to be able to get it. We'll have to either get in smaller quantities, or have to buy them second-handed from other countries at a higher price, which will needlessly, I say, affect everyone more, because if we don't eradicate this coronavirus now, we could face much more long-term issues and more economic downturn. Fair access basically means that everyone should be able to get um, access to this vaccine. Now, as been pointed out here, there are two ways of being able to distribute this. There are the private method way, which basically countries just buy up all the available goods and then they just use it there, or the other scenario, which is the fair share approach. And they've done the math on it, and they've shown that COVID deaths are 33% globally if they take the stockpiling scenario. But if they take the fair share approach, it is 61%. Now that's a huge percentage up. That is hugely effective, meaning that we have to take this fair share approach, not only because it's just better for countries overall, but it's better to dealing with this coronavirus so we don't have any more long-term issues. So imagine if somehow coronavirus affects vaccinated people again, and that will just harm and bring us all back to this lockdown situation that we're facing currently. And also, secondly, to be able to increase herd immunity. You may have heard this on the news and many other places all across the world, but herd immunity is an extremely vital thing that we need to consider. If a country, if let's say all the rich countries have herd immunity, all of them, but none of the poorer nations have it. What happens if the poorer nations go to the richer nations? It'll slowly affect people, not as a like huge significant rate, but it'll still affect them. And also it'll make the countries in a much more higher disadvantage with richer countries. There's a whole host of reasons why they should not allow COVID-19 vaccinations to be a stockpiling scenario. It should be fair share approach because that's the best option for everyone. Then there's the third reason, which is the logistical nightmare. So as this article pointed out over here, that one of the vaccines that have been developed has about negative 75 Celsius, right? So that's, as this article points out, not many hospitals have negative uh, negative 78, negative 75. And in some cases, some of them need negative 80 Celsius degrees. Uh, and this one instead has about negative 20 Celsius. Now, again, this is a logistical nightmare unfolding because they now need to bring more specialized things if this vaccine pulls in first, to be able to make sure that it doesn't just destroy itself and wasting huge amounts of money, and also waste making lives worse significantly because no one gets the vaccine. And that's the third reason. And the last reason, which is sort of tangentially related, is the vaccine hesitancy. Now, the vaccine hesitancy is basically meaning this. People who think like autism can be caused by vaccines aren't really right, but this huge misinformation has spread across to such an extent that people are hesitant to take vaccines in fear of the side effects such as autism. And again, I have an article here from the CDC disproving it with a whole host of studies. So I'll link that if you need any more information about that topic. But basically, that's another thing that's going to prevent vaccinations for COVID. Is if we don't get rid of this misinformation and say that COVID is completely risk-free or the risks are very minimal and are very short-term, we can then get rid of this virus much more quicker. Again, polio is an example of a virus we've eradicated, basically. But it was a hard won fight from defunding and to the obviously vaccine hesitation um, and whatnot. And we can't have something like polio. Polio, which is a objectively worse disease, had a long time to be defeated. We can't let coronavirus do this to us. We need to band together, inform people, and to tell them that this is not the case. That's why I'm doing this right here to inform you to be able to so that you can tell people that COVID 19 vaccinations aren't that much of a risk. Again, they're still looked for it, but it seems these risks are fairly minor. And again, some, very important, some. So yeah, there are a few other articles, such as the one by The Guardian, which basically just describes a bit more on how the free market uh, won't help get COVID-19 vaccinations all across the world. Again, from the Australian Therapeutic Goods Administration, providing his own thoughts on the topic. It's very interesting. I suggest you read it. Anyways, that has been all the information about coronavirus, the vaccination, and I suggest you all celebrate. You know, we need some happiness in this time of dreary days because this is just really amazing to see. Anyways, I hope you all enjoy yourselves and have a lovely day. Goodbye.